Hey, thank you for joining us for our presentation on cerebrovascular accidents, also known as strokes. Um, Presenting today will be Reagan Howell, Chelsea Peace, Jamie Scott, Brady Vickers, and myself, Whitney Willis. We'll be discussing the etiology, types of strokes, risk factors, clinical manifestations, treatment options, prevention, statistical data, and a case study. And as always, time lost is brain lost. Every second counts when treating a stroke. In regards to the etiology of strokes, it is the disruption of blood flow to the brain. There are three main subcategories. The first one is ischemic strokes, next, hemorrhagic strokes, and transient ischemic attacks. TIAs are also known as mini strokes.
Here we have an ischemic stroke. This is a thrombotic or embolic event that causes an impairment of blood flow to the area of the brain. Um, Most of the time, plaque builds up within the arteries, impeding blood flow, thus causing ischemia and causing an ischemic stroke. Plaque is the most common cause of an ischemic stroke. Next, we have a hemorrhagic stroke. This occurs when a blood vessel in the brain ruptures and bleeds, which can also deprive the brain of oxygen. Here we have the four categories of different types of bleeding, which causes hemorrhagic stroke. You have the epidural hematoma, you have the subdural hematoma, subarachnoid hemorrhage, and intracerebral hemorrhage. All four of these are determined on the location of the bleed within the brain. Next, we have the transient ischemic attack. This is referred to as a TIA, which is most of the time referred to as a mini stroke, and this often leads to an ischemic stroke in the future.
Now we're going to discuss the risk factors, controllable and uncontrollable. Um, Smoking and drinking are a controllable risk factor. Arterial fibrillation are a risk factor. High sodium intake. Then you move into uncontrollable risk factors, family history of an ischemic stroke, age. Anyone over the age of 65 is at a greater risk, gender and race. African Americans tend to be at a greater risk for a stroke. Um, Controllable risk factors is something that you have control over, whether it's cessation of something, eating a healthier diet, or exercise, or monitoring your insulin levels. Uncontrollable, you have no control over that. It could just be a genetic thing. Next, we move into our assessment scales. We use three different ones, NIHSS and the Cincinnati. We'll discuss on a later slide. One that is you can do by yourself at home is the FAST or BFAST scale. Here we're going to show you an example of the BFAST scale. It simply as it is, BEFAST. B for balance, loss of balance, headache, dizziness, confusion. E for your eyes, blurred vision. F for face, the onset of one side of your face is drooping. A for arm, arms or leg weakness on one side of the body. Typically that goes hand in hand with your face. Speech, you can have slurred speech or just speech where it's a little bit slower. And then T is the biggest factor. T is time. If you start to have any of these signs and symptoms, or especially more than one, we're going to ask that you go ahead and call 911 or seek help immediately in order to be able to reverse the signs and symptoms of a stroke. Here are those two scales that we were mentioning. The NIHSS scale is off to your left, 0 being the lowest level of not having a stroke at all, 5 to 15 potentially having moderate signs and symptoms or having a moderate stroke, and then 21 to 42 is a severe stroke. The Cincinnati scale is the one on your right. Basically is as it states, your speech, your arms, and your face, just kind of like that BFAST scale. So for your face, both sides are both sides move normally. So if one side is not moving normally, or you're having a little bit of weakness on the one side, that would be a point for that one. But if just your both sides of your body are equal, then you're not.
So the most commonly used diagnostic test is a CT scan. It may reveal brain damage, hemorrhage, or other issues that could be contributing to the symptoms of a stroke. An MRI can reveal alterations in the brain, which could rule out other illnesses that have comparable symptoms. An angiography may be performed to get a detailed image of the blood vessels. This is where a dye is injected into the veins. A carotid ultrasound provides a view of the carotid arteries, which carry blood to the brain, and this can reveal whether plaque has accumulated in the arteries. Since a stroke can result from irregular heart rhythms, an EKG would capture the heart's electrical activity and may also be performed. And then other diagnostics that might be employed are a PET scan or a DSA. A detailed medical history provided by the patient or family member can help determine if pre-existing conditions caused the stroke. Neuroexams are performed upon arrival to detect neurological deficits and provide a baseline, and then subsequent neuroexams are performed to determine if a patient is improving or declining. As we discussed, EKGs can identify cardiac issues, and lab work can identify issues with blood clotting or a lack thereof, infections, hypoglycemia, all that can mimic stroke symptoms, and this will be shown on a CBC.
So here we have the treatment. So the first four listed would be for ischemic stroke. So you have TPA or TNK, which is also known as the clot buster. That's typically given within 3 hours of onset. That's the ideal time, but the time frame ranges from 3 to 4.5 hours after the onset of symptoms. So you can have thrombolysis done and thrombectomies to remove the clot, and then you can have stenting in the area that was affected in that certain vessel. And for supportive management, that can go for both ischemic and hemorrhagic strokes. So you want to have cerebral edema management and disease management. So you want to have control of your blood pressure and your cholesterol that are, that could have led to the stroke. And for rehab, you want to do physical therapy, occupational therapy, and speech therapy just to minimize the amount of deficits that you might have following the stroke. And strokes can lead to a lot of depression and mental health issues in patients just because you can have permanent deficits from the stroke. And, if you went from a totally normal person and then ended up with paralysis on one side, that can be detrimental to your mental health. So you want to keep an eye on that as well. And for treatment of the hemorrhagic stroke, so you want to locate and stop the bleed. You can have a craniotomy done to remove part of your skull. That way they can see the bleed and get it fixed. Then you want to control the blood pressure, edema, and your ICP. You want to prevent rebleeding and prevent vasospasms. And here are the side-by-side comparisons for ischemic stroke treatments and hemorrhagic stroke treatments. So again, you want to give the TPA within 3 to 4.5 hours of first symptom onset. You want to give some other anticoagulants, and you can do surgical removal of the clot. And for hemorrhagic stroke, you want to do the surgery, the craniotomy to locate the bleed and stop it. You want to avoid any other blood thinners because you're already bleeding, and you want to do intracranial pressure management.
So the following phases are considered a stroke's natural history. In the acute phase, which immediately follows the stroke, and this is when symptoms are at their worst. Depending on the degree of the brain injury, there may be a very quick neurological decline. In the early recovery phase, the brain works to compensate for the damaged area, and some spontaneous repair may even take place over the first few weeks to months. In the plateau phase, which follows the first phase of recovery, there could be a pause in the rate of functional improvement, and you may not see very many changes. And then in the chronic phase, there are persistent neurological abnormalities, such as weakness, paralysis, speech, and cognitive impairments, along with sensory loss that can vary in severity dependent on the individual. So motor tracks start in the brain and cross the medulla. That causes sensory and motor issues on the opposite side of the brain lesion. A tumor in the right place might cause ipsilateral tumors, but that is very rare. Learning to walk and talk are examples of developmental phases, and that can be impacted by a stroke in certain cases. A stroke is not identified until a patient exhibits a developmental delay. Although recovery can last for months or even years after a stroke, it often occurs most quickly in the initial weeks and months. Cognitive skills include the capacity to study, plan, solve problems, focus, and retain information. Motor skills include difficulties with ambulation, vision, and speech, and then emotional and behavioral changes and developmental stages may also become affected.
Here we move into prevention. We have a little prevention checklist. Know the cause of stroke. So managing your high blood pressure, controlling your cholesterol, reducing your blood sugar, being more active, eating healthier food options, maintaining a healthy weight, cessation of smoking and drinking, and the medication as prescribed. Each of these are all controllable and great options to prevent a stroke.
And here we have some data on stroke. So in the US in 2022, 1 in 6 deaths from cardiovascular disease was due to a stroke. The death rate for strokes has decreased from 41.4 per 100,000 down to 39.5. Every 40 seconds, someone in the US has a stroke, and every 3 minutes and 11 seconds, someone dies of a stroke. Every year, almost 800,000 people in the US have a stroke, and about 87% of all strokes are ischemic strokes in which the blood flow to the brain is blocked. Stroke-related costs in the US came to nearly $56.2 billion in 2019 and 2020. And this cost includes the cost of healthcare services, medicines required to treat the strokes, because TPA is very expensive, and missed days of work. Stroke is a leading cause of death for Americans, and only 38% were aware of all major symptoms and knew to call 911 when someone was having a stroke. So this means that knowing the signs and symptoms of strokes and the prevention is key. Patients who arrive at the ED within 3 hours of their first stroke symptoms often have less disability after a stroke than those who receive delayed care. And we have a case study. A 57-year-old female presented to the ED with complaints of right-sided weakness, right-sided facial drooping, balance impairment, and difficulty speaking. Her past medical history obtained from her husband includes hypertension, social alcohol consumption, daily smoking, and prediabetes. Per the husband, the patient's symptoms started approximately 25 minutes prior to her arrival to the ED. So question 1, what diagnostic tests would you expect the patient to undergo? Select all that apply. So we have a CT, MRI, CBC, and an X-ray. And the correct answers would be CT, MRI, and CBC.
For question 2, which of the patient's past medical history would be at risk or a risk factor for stroke? A, hypertension, B, pre-diabetic, C, alcohol use, D, smoking, or E, all of the above? The answer to this question is all of the above. If you go back and review the checklist, all of these answers are there.
All right, in addition, a CT of the head was performed and revealed a cerebral infarct. By this time, it's been an hour since she first began experiencing symptoms. After the diagnosis is confirmed, TPA was given. What is the time frame for TPA to be given from the start of the onset of symptoms? Within 30 minutes, within an hour and a half to 3 hours, 3 to 4.5 hours, or within 6 hours. And of course, we want to give it within 3 to 4.5 hours.
Moving on to question 4, what lifestyle modifications could the patient make to prevent another stroke in the future? Select all that apply. Alcohol and smoking cessation, increased fat intake, regular exercise, medication compliance. The correct answer is alcohol and smoking cessation, regular exercise, and medication compliance. These are modified risk factors that can reduce your chance of having a future stroke, or even doing these things can prevent you from having a stroke in general.
So case study question number 5 is true or false. More than 85% of strokes occur as ischemic strokes. The answer is true. As shown in our statistical data, 87% of strokes are ischemic.
Here are some of our references for our project put together. And thank you again for joining us in regards to our stroke presentation. If there's any questions after the completion, please feel free to reach out to us. Our emails are listed below. Thank you.
Thank you.
Thank you.